All right, welcome everybody, and apologies for the technical difficulties, but we have our presenter on now, Matthew Johnson. So welcome to our Medicare Made Clear Get to Know Medicare webinar. I'm just going to read a couple of disclosures and then give you a brief introduction to Matt, and I'll turn over to him to take it away. So the opinions voiced in this webinar are those of the speaker, Matthew Johnson. Opinions expressed are for the general information only and not intended for specific advice or recommendations. So a little bit about Matt. He graduated from the best university in the state. As you guys all know, that's Washington State University, my alma mater as well. He has been in the industry for 20 years, has a degree in finance and insurance. And he kind of got into this because his dad was looking for information and assistance trying to figure out Medicare. And it's a complicated process, as many of you probably know. So he realized there were probably a lot of others who could benefit from this assistance, and now he helps thousands of Medicare beneficiaries. He lives in Puyallup with his wife and 2 children. He offices out of Puyallup, and the office is ran by him and his wife. And he meets with clients in the field if they can't make it into the office, or you can chat over the phone, be very flexible. So with that said, Matt, welcome, and I'll turn it over to you.
Thanks so much, Mike. I appreciate that. So I'm sorry for the technical difficulties. My camera wasn't working, and I apologize for the delay. I'll try to make it worth your time. So like Mike said, I got tricked into this by my dad about 14 years ago now. So I was an insurance agent working in the business, and my dad called me one day out of the blue and said, "How does this Medicare stuff work?" And I'd never looked at Medicare. I never tried, never had any customers really ask about it. So I started trying to dig in, and I was in the same boat as most of the customers that come in and see us are. I was trying to research something that I'd never looked at. I mean, my dad had always worked and always got his coverage from his employer. He never had to think about his health coverage at that point. And so it's kind of a scary thing. All of a sudden, you're losing your employer coverage, you're going to retire. And that's the process that I help people go through every single day. Me and my wife, we sit down, we go over how Medicare works and help people figure out, the plans, and we do a needs analysis to try to figure out what's going to be best for them to help shore up their Medicare coverage and figure out, what's going to work best for their budget and everything else along those lines. So tonight we're going to go over the basics. Here's how Medicare works. I'm not just going to throw you to the wolves at that point and send you off into the world trying to figure out what's going to work best for you and your family. I'll have you write down my information here. Like Mike said, my office is in Puyallup. I've helped thousands and thousands of people sort out how Medicare works and functions and what's going to work best for them. So there's thousands of options out there in the market. So like I said, we're going to talk about the basics of Medicare. And then after that, if you need help, give me a call. We go out into the field, we help people. You can come to the office. We have a nice, comfortable office to come sit in. Then we can go over this stuff. The best part about my job is at the end of the day, I can see the stress removed from the people's face after they understand, A, how Medicare works, and B, that they're in good hands, that they know what they're getting. And I'm an insurance agent, and I get paid by the plans. There's no cost for any of the customers to come and see me. It's all taken care of by the insurance company. So that's the best part. You get free advice, no cost. Even if we don't do business, you can always call me. The reason why I do these BECU seminars is everybody's so appreciative and thankful. They do a lot of good in the community, and I do these to try to give back and try to help people get the proper information because there is a lot of confusion out there. So to not waste any more time, we'll start getting into some of the slides here. So what we're going to talk about today, what is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? What does Medicare cover? Where can I get more coverage for what Medicare doesn't pick up? What does it cost? How do I choose Medicare coverage? When can I enroll? And when can I change my coverage? Because it's not a lifetime decision. And then some ways to try to save some money. So first off, Medicare, it's a federal health insurance program. So it's generally for people. So it's a federal health insurance program for U.S. citizens and legal residents. It's funded in part by taxes that you paid. So your FICA that comes out of your Social Security or comes out of your paycheck every time you work, that's how it's funded. and it's an individual health plan. So it's not for you and your family. It's for the person that is purchasing the plan or going on Medicare. Medicare is definitely not free. And like I said, it's not a family plan. It's not Social Security, and it's not Medicaid. So what is Medicaid? Medicaid's a state-run program. So if your income's low enough, you can qualify for Medicaid in certain states. The programs do vary from state to state. And, if you have questions on those programs, you can always contact me or contact DSHS. That's who does the Medicaid here in Washington. I think most of the people on the video today are in Washington. So I'm going to talk about Washington-specific things. I am licensed in most other states. So if you have questions about other states, I can probably help you with that as well. So Medicare and Medicaid can work together. A lot of times they're called dual eligibles. So if you think you might qualify for Medicaid, we could talk about that and look at those options as well. So who can get Medicare? So it's U.S. citizens and legal residents. So legal residents must live in the U.S. for at least the last 5 years in a row. And generally it's for people that are over 65. But if you're under 65 and you have ALS, or end-stage renal disease, you also qualify. It's also for people under 65. If you're disabled and you've been disabled for more than 2 years, a lot of times people under 65 that are in that situation will also qualify for Medicare. Can you have both Medicare and Medicaid? Yes. So there are some people that get on Medicare. So Medicare is a federal program. Generally, when you turn 65 or become eligible for Medicare, the state of Washington or the state that you reside in, they'll have you apply for Medicare. If your income's low enough, you can still apply for Medicaid to help pay some of the costs associated with Medicare. Do I need Medicare if I plan to work past 65? So a lot of the people that are on these seminars that contact me after these meetings and stuff with BECU, a lot of them are working past 65 these days because the full retirement age for Social Security generally is 66 in 4 or 5 months, depending on when your birth date was. And so we see a lot of people working past 65. So you may not have to enroll when you first turn 65. A lot of people, if your employer has more than 20 employees, they may opt to just continue with their employer coverage at that point because they have credible coverage and they don't necessarily have to enroll in Medicare at that point. So if you have fewer than 20 employees with your employer, you would want to enroll into Medicare at that point because that's not deemed credible coverage. And if you don't enroll when you're first eligible for Medicare, there may be penalties down the road associated with enrolling at that point. So what if I'm covered under my spouse's employer? If you're covered under your spouse's employer, you'd want to talk to them and just make sure that you don't need to enroll into Medicare. Certain companies that want you to enroll into Medicare because it will reduce the cost of them for covering you on that business plan. So getting Medicare while you're still working, you can enroll into Medicare when you're still working. A lot of people will sign up for Medicare Part A. Medicare Part A doesn't have a cost, so people will do that when they turn 65. But you cannot do so if you're paying into an HSA. So if you have an HSA at work, you would not want to contribute, or you would want to stop contributing if you're going to sign up for Medicare Part A, because you can't have both. You can't have any part of Medicare when you're doing this stuff. If you do sign up for Medicare, generally, if you have more than 20 employees at your employer, Medicare would be secondary to that plan. So depending on the costs and coverage, you'd want to talk to somebody about whether that makes sense for you to do so at that point. So another thing to think about is if you sign up for Medicare and you drop your employee coverage, your spouse or your dependents may not be covered on that plan after you leave. So what does Medicare cover? So there's 2 parts to original Medicare. There's Part A and Part B. So Part A, generally they call it hospital insurance, and Part B generally is the medical insurance. So Part A, hospital coverage, usually I tell people it's your inpatient care. So it's going to cover you if you go to the hospital, skilled nursing, home health care, and hospice, but it doesn't cover everything. So there's certain things like the TV, the nursing services and stuff may not be covered. in certain instances, but most of the time it's going to cover your room and board while you're in the facility. So it's going to cover the like I say, the Jello, the nurses, unless they're doing like custodial care. It's going to cover hospice, blood transfusions while you're in a facility. It's going to cover most of the stuff based on your room and board when you go into the facility. So fast facts, Part A doesn't have a premium. As long as you or your spouse has worked for 10 years or longer, most people qualify for Part A at no cost because you paid into the system your whole life. You've been paying into FICA, and that's what covers your Medicare Part A. So you can't be denied coverage. The coverage is nationwide, so any hospital you go into in the U.S., you're going to be covered under Medicare Part A. The benefits, so with Medicare Part A, there are some costs. So if you get admitted to the hospital, you're still going to have to pay part of the cost when you go into the hospital, and those benefits are per benefit period. So like if you get admitted to the hospital, you would have a deductible this year of $1,600. That allows you to stay 60 days. If you stay longer than 60 days, they're going to start charging you a daily rate. If you leave and you're out for more than 60 days and you come back, they're going to welcome you with another deductible. So it's a per period benefit. So it's not an annual or anything else. Every time you go in, stay longer than 60 days, you get a daily rate. You're out for more than 60 days, you go back, another deductible. So Part B medical coverage, this is everything else. So this is going to be the doctor at the hospital, the anesthesiologist. It's going to be all of your doctor's appointments outside of the hospital, outpatient surgeries, chemo treatments, durable medical equipment, everything else that isn't covered under Medicare Part A for your room and board is done under Medicare Part B. So this is the majority of the costs that we're going to see when people have, chronic illnesses and stuff like that. And so this is what is going to help cover you when you're doing stuff outside of the facility or even the doctor at the facility. So I'll say the cost for Medicare a couple times. Medicare Part B this year is $164.90 a month. If you're automatically, if you're drawing Social Security, they automatically take that out of your Social Security. If you're not drawing Medicare, they're going to send you a quarterly bill for that amount. If you make more than $97,000 as an individual or $194,000 as a husband and wife, they may charge you more for your Medicare Part B. If you've just stopped working, there are some forms you can fill out and try to reduce that back down. And I do get a lot of calls, emails after these seminars with people asking me about, the different situation as far as how much the Medicare is going to cost them. So some fast facts about Medicare Part B. We talked about the monthly premium adjusted for income. You can't be denied coverage. Coverage is nationwide. And there is a penalty for not enrolling when you're first eligible for Medicare Part B. If you continue to work like we talked about, and you've had credible coverage through your employer, more than 20 employees, you would have to have your employer fill out a form stating that you had coverage from the time you were 65 until current. And then you can enroll into Medicare Part B with no penalty. So I have those forms at my office. If you want those forms, you can always email me and I can send them over to you. Or if you have questions about any of that, just let me know and I can always assist. So stuff that Medicare doesn't cover that you're going to be facing once you're on Medicare. Medicare does not have a max out of pocket. So a lot of people will sign up for another program or a plan, which we're going to go over tonight, to help shore up their Medicare, because Medicare does not have a max out of pocket or limit as far as what you can pay. It also doesn't cover prescription drug plans. There is no dental, vision, or hearing. There is no glasses coverage. So a lot of times your employer plan or your coverage may have had these options built into it, and now you no longer have these options. That's what we talk about too when we're going through a needs analysis. How can we shore up and get some more coverage to cover some of the stuff? So it doesn't cover long-term care. So some people will opt to purchase long-term care coverage to help if they end up in a facility long-term. It also doesn't cover excess charges. So certain doctors that may not accept Medicare or the Medicare assignment, they may charge you extra for those services. There's also no care outside of the United States. So if you're traveling, there's no coverage through Medicare And so that's why a lot of these plans will have a coverage that will cover you outside the US as well. So where do I get more coverage? The first plan we're going to talk about, so there's a couple options you can do. There's option one and option two. The first option we're going to talk about is Medicare Advantage plans. So these have become very popular over about the last 15 years. They've become more mainstream. When I first started doing this, we saw most people that had, a supplement and a drug plan, but these have become more popular. These are the TV ads that you're going to see all over when you're watching the news and stuff like that, especially during the annual enrollment period. This is generally what they're talking about. So the way Medicare Advantage plans work is they're run by private insurance companies. The way that I explain it to people, the easiest way to understand it is Medicare subcontracting your Medicare to a private company. So they're taking the money that they're collecting from you for your Medicare Part B, along with other funds that they have in reserve to pay claims and stuff when you go into the doctors. And they're sending that premium or subsidy to an insurance company, and they're taking over the risk for original Medicare. So when you go to the doctor and hospital, you don't show them your Medicare card. You'd show them your Medicare Advantage plan card. These plans still have to cover everything Medicare covers. They have to be the equivalent to or better than what Medicare covers. Most include the prescription drug plan built into it. And then they have additional benefits that Medicare doesn't cover, such as dental and vision, which we'll talk about more. So with these plans, you have to live where the plans are offered. So when you're watching TV, all the ads will say, in your zip code, you may qualify for this, or you may qualify for that. You have to live where the plans are offered, and that will determine which plans are available to you. So that's what we help people look at, is what plans are available, what plan is going to work best for your needs in your service area. So Medicare Advantage plans, like I said, they cover all the parts, Medicare A and B. Most of the time they have the prescription drug plan built into it. We do have some plans in the market where if you have TRICARE or VA benefits and you don't need the prescription drug plan, there are plans specifically built for those type of beneficiaries. But they offer additional benefits. A lot of them have the gym membership built into it. They're going to have some hearing benefits, coverage for your glasses, and then most do have some dental built in to kind of shore up those coverages for beneficiaries. So the different types of Medicare Advantage plans that you're going to see out there in the market, you're going to see a lot of options, but most of them are going to be either HMO or PPO plans. So HMOs, generally you have to go to doctors that are contracted with those plans. You have to live within the region in which they're offered and do all your doctoring in those areas. They also have these PPO plans that have become very popular over the last number of years. Those are plans where a lot of times you can schedule doctor's appointments outside of the network. So you'll have a network of doctors that are preferred. Outside of the network, you can still access care. But a lot of those provide flexibility to see doctors outside of your regional area as well. So like my in-laws, they have a plan. They live down in Arizona part of the year. They have a PPO plan that provides them that flexibility to see doctors outside of the area. We also have some chronic needs plans or SNP plans for people in certain needs. Like if you're dual eligible, you have both Medicare and Medicaid, you would be eligible likely for one of those options, and that may be a good fit. So Medicare Advantage plans, like I talked about, you have to live within the service area where they're at. You have to have both Medicare A and B in order to enroll into a Medicare Advantage plan. So you still have to pay your Medicare premium. That's how these plans are funded. So that's one question that I always get towards the end. They're like, well, wait a minute, do I still have to pay my Medicare? Yes, you do. So the costs vary by plan, and they can change each year. So every year, beneficiaries get an annual notice of change that comes in the mail that says, here's the changes for next year on your plan. And then you read through it and see what's going on as far as the premiums or if the benefits change. But they can change from year to year. And that's why it's good to have a local agent to help you out with those things plans change sometimes. And like me, I reach out to my customers and say, look, the plans just changed. We need to tweak it or look at this other option because you can save some money and the benefits are similar or better based on what's going on in the marketplace. So I always tell people, if you don't like the way that I cut my hair or whatever, there's a lot of agents out in the market that are there ready and willing to help people. And it shouldn't cost you anything for those services. So one other thing I'd like to point out, I'm going to go back real fast. Every single Medicare Advantage plan also has an annual max out of pocket. So like with Medicare, there is no max out of pocket. All of the Medicare Advantage plans do have an annual max out of pocket. So one of the other options you can do, option one, where you go and pick up a supplement and then add a prescription drug plan. A prescription drug plan, you can purchase these standalone. They don't have to be tied into a Medicare Advantage plan. So people with a supplement, generally they'll go out and buy a prescription drug plan or Part D plan as well. Like it says there, sometimes they'll be tied into a Medicare Advantage plan. And I want to make a note that all of these slides, or most of the slides, we have a handout that at the end you can request a copy and they can email it to you. I'll give you the email when we get to the end and you can jot that down and request the information again. I'm going kind of fast because we had the delay and I apologize for that. But I'm here if you need me after. I'll give you my information again and you can always contact me for any questions. So Medicare Part D plans, prior to 2006, people on Medicare had no prescription drug coverage. So the government came out, they wrote legislation and they started these Part D plans. They're all offered by insurance companies. They all have, a formulary where there's certain drugs that they cover. Most of the plans are going to cover all the typical drugs that are going to be covered by Medicare. But not everything's, covered under the formulary. So it's important to look at the different drug plans to make sure that your prescriptions are covered before you enroll into a prescription drug plan. So let me back up. So all the formularies generally break the drugs down into different tiers based on the cost. The higher the tier, the higher the cost of the medication. So it's similar to most of the employer plans these days. My employer plan, all the drugs are broken down into different tiers based on the cost as well. So every single drug plan, whether it's tied into a Medicare Advantage plan or whether it's a standalone drug plan, they all have the same makeup or characteristics. They all have 4 stages that you must go through throughout the year, depending on the cost of your medications. So the first stage is the deductible stage. So some plans have no deductible. Some plans have up to a $505 annual deductible that you have to pay first before you get any prescriptions. So the deductible, again, just like your employer plan or the other Medicare Advantage plans, a deductible is something that comes out of your pocket first before you get any coverage. Once you meet that deductible, then you fall into the initial coverage stage. At that point, most plans will have copays that you're responsible for, and you pay your normal copays, and the insurance company picks up the balance of the prescription drug. Once the total retail cost of the medication, so what you're paying, plus what the insurance company pays, if that reaches $4,660, then you fall into the coverage gap. Generally, they used to call us the donut hole when I first started, because once you hit a certain dollar amount, you had no coverage. You had to buy all your medications at that point out of pocket. These days, once you hit the $4,660, then you start paying 25% of the cost of the medication. And the manufacturer is paying about 70% of the cost. They allow what you paid prior to the gap, plus what you're paying in the gap, plus what the manufacturer is paying. If that hits $7,400 during the year, then the cost of your medications go back down. Then you get some relief based on what you're taking. I tell people you don't have to worry about tracking all of this. This is going to be done by your prescription drug plan, because every time you fill your medication, they're going to send you a notice saying, here's how much we paid, here's how much you've paid, here's where you're at in relation to the coverage gap, and then catastrophic. So just some reminders here. In order to be eligible for a prescription drug plan, you must be enrolled in Medicare Part A, Part B, or both. So you can buy a drug plan if you just have Part A. You can buy it if you have Part B. But a lot of times most people have both if they're on Medicare, so that they have not only just the facility charges, but they also have the medical charges. So some prescription drug plans require to use an in-network pharmacy. They may limit where you can and can't go to get your prescriptions. So that's another important component when we're doing a needs analysis to figure out which pharmacy you're going to and which one would work best on the prescriptions that you're taking. So another thing to remember, if you don't sign up for a prescription drug plan when you're first eligible, you may have to pay a penalty down the road unless you have a special enrollment period. Again, if you've had employer coverage, they have prescription drug plan that's deemed credible coverage through your employer, then there is no penalty when you sign up down the road. You just have to notify them. What will happen is once you sign up for your prescription drug plan, they'll send you a notice saying, we see here you didn't have a drug plan when you were first eligible. Now you have to pay a penalty, and unless you've had coverage, please let us know, and then they waive the penalty. So finally, we'll get down to Medicare supplement plans or Medigap plans. They have all these different terminology to make it even more confusing, is kind of what I joke about. The way supplements work is you must have Medicare Parts A and B in order to have these plans. They can't be used with the Medicare Advantage plan, because the way Medicare supplement plans work is Medicare is your primary insurance. So when you go to the doctor and hospital and you're on Medicare, you show them your Medicare card, Medicare pays their portion, and then these supplements are just waiting in the background to pay all or some of the balance depending on what plan you pick. And so all of these plans are standardized now. They were standardized, I don't know, 13 years ago or something now. They standardized these plans to make it simpler. So every company is selling you the same thing. Different companies will charge a different amount for the same thing, I guess based on their size of the company and everything else. All these plans are offered by private insurance companies. So when you're on Medicare and you buy a supplement, like I said, Medicare is your insurance. Medicare determines whether it's covered, whether it's not covered, and these supplements are just waiting in the background. So some of the things that we talked about previously here. So Medicare, these plans can help cover some of the stuff that Medicare doesn't pick up, like the co-insurance at the hospital. It can pick up, the cost of blood for transfusions. Some of them will have extra days if you end up in the hospital, because Medicare, they'll cover you the first 60 days, 90 days, up until 60 to 90, you pay a daily rate. After 90 days, you only have 60 lifetime allowable days in your life for the extra hospital days. So this might pick up some of those. It may pick up some of the deductibles depending on what plans you pick. It may also cover some foreign travel. And then it may pick up the charges that the providers don't charge because they're not associated, or they don't accept the Medicare assignment. So the plans do not help cover, you'll see there, the prescription drugs. They also don't have any of the extra ancillaries or goodies that you're going to find on a lot of the Medicare Advantage plans, such as glasses and the custodial care, routine dental, some of the stuff that you'll find by buying other coverages. So here's a list of the different Medicare Advantage plans side by side, where it shows the different coverages. Most of the people that come into my office these days that purchase a Medicare supplement plan, they're going to purchase Plan G as in George. So you'll see Plan G there in the middle of the screen. The Plan G is going to pick up everything but the Part B deductible. So if it's covered by Medicare, you're going to see there that the Plan B is going to pick up everything else 100%. So the Part B deductible this year is $226. It can vary from year to year, but that's what we're looking at for 2023. When you go into the doctor and you start the year with Plan G, you'd have to pay that deductible. Once you pick that up, as long as it's a Medicare covered service, you'll see there everything else is 100%. That's a popular one when people come in and we're talking about supplements. That's generally the one that most people are looking at. Traditionally, most people prior to 2020, a lot of people would go out and buy the Medicare Plan F that covers everything. So we'll talk a little bit more about these costs as we get down the road here, but this may be a good plan for people that are chronically ill, that go to the doctor a lot, because you can basically prepay your medical costs. Okay, I pay my supplement premium. Once I meet my deductible, then it's going to pick up everything else 100%. So again, in order to have a Medigap plan or Medicare supplement plan, you must be enrolled in Medicare Parts A and B. You must live where the plans are offered, and you must continue to pay your Medicare Part B premium if you're on one of these plans. Guaranteed issue. So one thing about Medicare supplement plans is you can enroll into a supplement plan when you first turn 65, or enroll into Medicare Part B and it's guarantee issue. if you get beyond that period, some of these companies can fully underwrite, and you may not qualify for a supplement at that point. So how much does Medicare cost? So a lot of the stuff that we've talked about, your premium, deductibles, co-pays, and co-insurance. So premiums are what you pay for the plan. Deductibles are what you have to pick up before the plan starts doing anything for you. Co-pays are what you have to pay. Like if you go to the doctor on certain Medicare Advantage plans and stuff, you may have co-pays associated with that. And co-insurance is a percentage that you may have to pay either on your medications or on doctor visits and stuff like that. So people, okay. So I'm going to try to go through this. A lot of people ask me, how do I pick? What plan do I look at? Most of the Medicare Advantage plans that you're going to look at, they're going to be lower cost. So they're going to be, there's a lot of zero premium plans in the market, or they're going to have a lower premium, because on those plans, you're going to pay some of the costs. You're going to pay some of the co-pays and stuff like that. So I generally call that the pay-as-you-go plan. Those are generally $0 or $34 is a popular one in the market. The prescription drug plans usually run $30 to about $110 a month, depending on what plan you're picking. The lower cost plans are going to have deductibles built into them. So if you're taking prescriptions, I usually say they're about $50 a month. And then the supplements, most people come in, they're buying Plan G. It's going to be somewhere around the $200 mark. So, option one, where you buy a supplement and a drug plan, you're going to be around $250 a month, where the Medicare Advantage plans are either zero or no cost. And this is what when my dad called me and said, how do these Medicare plans work? He was paying a really high amount for a supplement and a drug plan, and we ended up switching him over to a Medicare Advantage plan to help him save some money. And that's worked really well for him over the last number of years. But it's not one size fits all. So that's why I tell people it's good to talk to somebody to figure out what's going to work best for your own needs. So how do I choose? There's a whole bunch of different variations. Like we talked about during the meeting, you can do a Medicare Advantage plan. You can do a supplement with a drug plan. There's a bunch of different options. And that's why it's good to talk to somebody to do a needs analysis to see what's going to work best for you. So we're kind of running out of time. So I want to skip forward to some of this stuff. So when can you enroll? Most people enroll during their initial enrollment period when they first turn 65. So the 3 months prior to their birth month or the 3 months after, that's your initial enrollment period where you can pick a plan. If you enroll prior to your birth month, it'll start your birth month. If you pick it after that, it'll start the first of the month after you pick. It's not a lifetime decision either. So there's also the general enrollment period. If you miss your initial, you can always sign up down the road, but you may have to pay a penalty. There's the Medicare supplement open enrollments, like I talked about prior. They can't deny you if you sign up when you first turn 65 or get your Medicare Part B for the first 6 months. A special enrollment period. So if you're working past 65, you can enroll anytime. As long as you can demonstrate you had prior coverage with your previous employer, you can always enroll into Medicare throughout the year. So, and I can get you the forms to get enrolled into the plan. Late enrollment penalties may apply if you don't sign up for Medicare Parts A, B, and D when you're first eligible. So when can I change my coverage? I tell people every year you have the annual enrollment period where you can switch your coverage. So between October 15th and December 7th every year, that's when you have the option to pick a different plan, and that plan would start the 1st of January. Medicare Advantage open enrollment period. So after the first of the year, if you pick a Medicare Advantage plan, you can always change your plan the first 3 months of the year. I call it your get out of jail free, and you can pick another plan that would start the 1st of the next month. So some people have certain qualifying events. You move, certain things happen. You may also have another special enrollment period. You can always ask me, we can go over those different options. So how can I save money? Most of the time you want to use in-network providers. You want to make sure that all your doctors and stuff are in network, and use providers, like I said, that are within your plan's network. So, okay. So there's different programs. If you're lower income, there's a bunch of financial assistance programs out there, either with the hospitals, with the federal government, or with the state government that I can help you enroll into. Here's some information here. Like I said, we'll send out the handbook. Where can I go for help? You can always go to medicare.gov. We also have some resources that you can go to. So, sorry, I'm kind of clicking through these quick to get through. So I'm going to leave this disclosure up here for a minute. I want to thank everybody for coming. I apologize again for the technical difficulties. I'm not, like I said, just going to leave you hanging here. If you have questions, you need assistance, please reach out to me. I've helped thousands and thousands of people sort out how this stuff works. If I can't answer it, I'll figure out the question or figure out the answer for you. But I'm going to let this disclosure go, and then I'm going to go back to my information one more time here. So here's my information again. If you want to get a copy of the information from the seminar, you can email investmentservices@becu.org. You can also email me and I can send you a copy. My phone number is also there. Like Mike talked about, me and my wife work together. So if you call the office, you may get to talk to her. She knows what she's doing too. But I appreciate everyone coming on tonight. Thank you so much for taking your time. I know that it's an important decision. That's why I do this stuff, is to try to help people figure this stuff out. It might be one of the most important decisions you make in your retirement. If you pick the wrong plan, I've seen it where you can put yourself in a bad situation. So if I can be of any assistance, please reach out to me, like I said, and thanks again for your time.